Hello everyone, welcome to this week's episode on Laid Back the Atiozinga podcast. Our topic for this week is medical pilgrimage, Sojourn in the Middle East. And our guest for this week is Dr. Ugo Anekwe, who is a GP here in the UK. First of all, I want to say thank you for honoring the invitation again. How far?
Hi, Arinze. Yes, like you said, I'm Dr. Ugo Anekwe. I'm a GP here in the UK, and I've just come to talk about medical pilgrimage, Sojourn in the Middle East, like Arinze said. I'm happy to be here on the podcast, and thank you for having me. So let's see what we can do what kind of justice we can do to this topic.
But just to remind the listeners and the audience, this is your second time on the show. Actually, the last time you were here, we talked about nature versus nurture.
Yes, we did. I think that was like maybe 6-7 months ago. Yes.
Yeah.
So it was a good one. I remember how that went. Yeah. So let's see if we can digest this one like we did for the last one.
Hopefully. So let's start off. First of all, let's define what a medical pilgrim is. So who is a medical pilgrim?
So a medical pilgrim essentially is just someone so a medical professional who sort of leaves his comfort zone or his primary place of abode and ventures into other frontiers to engage in medical work. That's just it in a nutshell, in the simplest of sentence, which anybody can understand. And so that's what medical pilgrim is essentially. So pilgrims, as you know, they leave their primary spot and go to other places and get engaged in activities. So just same as medical pilgrim, it's just the same thing. Go to other places, get engaged in work, and they might return back to their original places, or they might not, or even go to other places as well. So that's essentially what a medical pilgrim is.
So when you say other places, are we talking about different cities in a particular country, or different countries, different continents? What does that mean?
Well, in this sense, of course, it should include other places in the same country, but it's usually used for other countries outside your country of origin or your main country, and other places, other continents, regions, parts of the world.
Yeah.
So places outside your country.
Okay. But pilgrimage has always been would I say is an old word per se. So when you talk about medical pilgrimage to the modern individual, what does that actually mean?
Okay, essentially just means you live in your country where you've been born, raised, schooled, worked for a while, and moved to another country to get involved in work. That's what medical pilgrimage is.
Okay. But away from the medical side of things, life itself is a pilgrimage. Even just traveling from here to whether it's Dubai or Barbados or whatever for holiday is kind of is pilgrimage. So, and also if you think about it, the way things we read, novels, or everything we've read, the way we write, the way we connect to everybody around us is still pilgrimage. So, what do you think about your own journey? Thinking about your own journey, do you think your own journey, both just normal life experiences and the medical pilgrimage, things you've done so far in your career and your life, do you think it has actually helped you to discover who you are?
Oh, of course, yes. So of course, we all have like different reasons for which we've moved around. People travel for family reasons, move away for financial reasons, which is the likely commonest reason. Some for professional reasons, career advancement. For me, of course, when you move from your country or your place where you're usually based to somewhere else, there's a change in the environment, change in the culture, and change in real life happens around the change in the working environment as well. And then that helps you. And when you do a lot of introspection and reflection on what you've done so far, and you realize that you've actually changed a fair amount. You see yourself in different ways. I've done a bit of movement, and I know how I was when I was in Nigeria, for example. I'm in the UK now. I know how I am now, and I know that there are things. Of course, that also coincides with time being spent on earth and getting older, and being more aware of yourself as well. Because as time passes, you're more, aware of how your life actually works and who you are personally. Yes, definitely. As you make these movements, change environment, interact with different cultures and different, ways of life, you tend to, see yourself in different ways and get a better understanding of the kind of person you are. Yes.
Yeah, because this is the reason why I asked. Like, most times people do pilgrimage. The most common one is religious pilgrimage. Most of the time, they are trying to find themselves and to save their soul, if that's the way to put it. So I don't know if that's the right way to put it, but looking at it now, yeah. You said when you move from one country to the next, there's this shock. Do you think that cultural shock actually will make you to actually try as much as possible to change and adapt, and then you realize, oh, you can actually do this, you can actually do that? Do you think it has an effect as well?
Yeah, of course. I mean, if you're going to move from a country to another country, you would obviously see the differences, the stark differences in behaviors and ways of life, and it's going to be difficult for you not to sort of imbibe a few things from those people. It's going to be difficult for you not to integrate to some extent, and that integration would involve changing a few things about yourself, changing a few things about the things you do and how you see life. So it's almost inevitable for you to move from a country to another country and not change a few things about yourself, and that's quite normal. So what differs between all of us is the degree of change. Some people change a little bit, and why some people change to some very great extents. But yeah, that's definitely something that's going to happen. It will change.
Definitely. But when you first moved, you moved from Nigeria to the Middle East before migrating to the UK. So what was the experience like in the Middle East?
That's a whole book in itself. I think like we said earlier, that there are various reasons why people move, and a lot of it is financial. The first chunk of it is for financial reasons and for better wages.
Yeah.
Then you can talk about better quality of life and professional reasons. But at the top of the list is financial reasons. Yeah. And of course, I just wanted to leave Nigeria at the time. I was in Lagos at the time. It was not a very great place for me, and I moved to Saudi Arabia because all this happened in like the space of 3 months maybe. Yeah. I did not want to move in the first place. I was going to come to the UK directly, but like you said, the funds were not funds in.
Yeah.
And I had to make a detour that would sort of be a stopgap, and that's where Saudi Arabia came into the picture. I was there for 18 months, and it's the thing about Saudi Arabia where you realize that growing up we kind of had an idea of what life in the West was like, even life say from movies and books.
Yeah.
In the West was like, in Latin America was like, in Europe, in the West, yeah, and then even in Asia, you know what life in the Indians were like. Yeah. I never really saw Arabs on TV, so I never really knew how life was. I mean, I didn't grow up in the North. I never really visited the North, so I didn't know what was like in that kind of environment where there was Islamic influence on the culture. So I just went there. I was like, you know what, I just needed to leave. And I left, and it was a big difference. It's a very, very big difference. So life in say Jisan, which is the city where I was in, compared to Lagos, was a very, very big difference.
Yeah.
There was a very big it was a very big change for me. There's of course a lot of the change was affected by the fact that it was a Sharia country where Sharia was practiced as it should be practiced.
Yeah.
And so there's a whole sequestration of men and women. The fact that there are prayers 5 times a day and offices get shut 5 times a day, well, except for like maybe 5 a.m.
prayers.
Yeah, and I mean offices like banks, shops, barbing salons, everywhere, everything you can think of. Even some of your fellow colleagues might just sneak away during that period to go pray and spend a bit of time as well while at it.
And then come back.
Even things like the weather was very different. We had like 40 degrees plus temperatures, maybe rains like 12 times a year.
Yeah.
There's the fact that you'd be far away from people like yourself. The culinary differences as well,
Yeah.
Different cultures have their different meals. Life got better in terms of the fact that you earn more, but there are little avenues to enjoy yourself socially as well. Because, I mean, not as it should be, but our idea of socialization involves certain kind of vices, certain activities that might not be, compatible with what Islam preaches as pious and proper behavior. So, there's alcohol, you don't socialize with women, you don't sit around and make noise in public places as we would do in Lagos, and so a lot of times we're just hanging out with a few friends indoors most times. You know, and it was a shock for me who used to be an outgoing person and quite introverted. I had to adjust. I was lucky I had Nigerian colleagues who made it a bit, you know, a bit not as bad as it ought to have been, but yeah, it was a big shock, and being far away from home as well.
Yeah.
And of course, there was an extra twist to my story which made it even a bit different. Was I was close to Yemen, and it was a war zone.
That was during the crisis, yeah.
Yeah, and so they had my hospital was 13 kilometers from the border.
Yeah.
I don't think that's as long as Third Mainland Bridge or thereabouts. Not quite long. And so and they had, like, you know, soldier casualties in hospitals and bomb threats and all that stuff, and that added a twist to the tale as well. So it was just very, very different experience for me.
Oh wow!
I won't be forgetting in a very, very long time.
That's a huge
stories for grandkids.
I'm telling you, that's a huge contrast to what you're used to in Nigeria.
Yeah.
But if you're asked to compare now, like your medical profession in Nigeria and healthcare, access to healthcare, our behavior to healthcare in Nigeria, and compared to what you saw in the Middle East, how do they compare?
Okay, so first of all, so the fundamental problems how healthcare is being set up in Nigeria. Saudi Arabia, you know, we're both oil producing countries. We're supposed to be both oil producing countries.
Yeah.
And they have a monarchy, and they've tried to use their funds to set things up properly, infrastructure wise. And so the healthcare there is free. You know, if you're treating malaria, for example, it's free. If you're having a brain surgery, it's also free. Everything is free. Everything is free for citizens, and it used to be free for us as well.
That's the immigrants.
The immigrants are working with the government, yeah, but I don't know if it's changed now.
Yeah.
And then if you add free healthcare to proper infrastructure, I mean, you can see a very small hospital of nowhere that has CT scans and MRIs. That shows you the level of penetration. You have specialists of various specialties. Of course, there are limits to that, but they had all of that in their hospitals, and it was all free.
Yeah.
Compared to Nigeria, where
you have to pay a lot.
there's a bit of problem with infrastructure. You know, and some states don't have certain specialties. You have some very scary doctor-patient numbers in the north. You know, and certain parts of the south as well. You hear that there might be only one neurologist in the whole region. Some very outrageous things like that you don't want to you can't actually believe. And so that's one part.
Yeah.
And so because of the funds, so the government has set things up for them to get it free.
Yeah.
Of course, because it's free, that sometimes affects the way they approach healthcare, because when things are free, people tend to take it for granted, and so they get
and abusing.
So so the health seeking behavior is not so good. But I think I'll say the same for Nigeria as well. I think ours is probably poorer, only because
you have to pay.
Apologies to listeners. You know, superstitious mixes in the picture.
Yeah.
That make things worse as well. So there's that complicates things, and I think on the average, healthcare is a lot better out there. Do you think that Saudi Arabians used to come to Nigeria sometimes in the 60s? And I've heard about when they came to Ibadan.
Yeah.
I think one of the royal family members came to Ibadan like the 60s.
Yeah.
Or 70s, I think. And a lot has changed now. Now they have world-class hospitals, world-class facilities, things that I might not even see in the UK here as much in certain towns. You know, so they do have a lot of healthcare is money spending.
Yeah.
They're going to have to invest.
Yeah.
And they have the luxury of benevolent monarchs who are kind enough to set things up for them. So infrastructure-wise, they are good. Healthcare attitude-wise, well, they have it all. So they have things in ground. So they just come in and take advantage of what they have available, and it's not a problem for them. You know.
Yeah.
Back home in Nigeria, you know how it is. You have poor healthcare facilities. I mean, I worked in Nigerian hospital before I left. There's a problem of healthcare is not free. I've had to pay out of pockets for patients of mine, you know, and then there's also the fact that we have things that alter health-seeking behaviors, and people. But money is also a problem, because I feel like if healthcare was well funded in Nigeria, we would have had people doing more, visiting hospitals more, and not exploring other alternatives, because because they can't afford to go to hospitals. There's that twist to things as well. People are seeking other options because they can't really afford hospitals. It's not that free. They think they can manage or find other ways. So imagine you going to hospital and they tell you your CT scan is 70k.
Yeah.
And that's like half of your wages, and you probably want to explore prayers first.
Yeah.
Because that might be an option. So there's that as well.
Yeah. I was about to say the same thing, but you've already mentioned big because you said most of the reasons why people don't go to the hospital on time in Nigeria is because of religious belief. So I was wondering, if everything was set in place, everything was working, do you think like the religious superstition will actually be removed and people will go to the hospital more often?
Yeah, I
Sure. I think if we had, for example, free healthcare,
Yeah.
people are going to explore what is available,
Yeah.
and that's what it is. And because that's not available, I mean, it's a combination of both. But people tend to move towards other options when
What they want
what should be available is not present.
Yeah.
Yeah. So I think if you had free healthcare, you could just walk into a hospital without having to pay. If you had headaches, if you had injuries, we'll be more willing to exploit. So the fact that we're leaning towards those alternative options, like traditional medical options. I'm not saying that they don't work. I'm just saying that they're probably not as effective as, or anywhere close to, or not regulated as orthodox medicine is.
Yeah.
And so religious options as well, those things don't really fly as much if people could walk into hospitals for the slightest of things and get it sorted. And that's the truth about Nigerian situation.
I actually agree with that, to be honest. But looking at your journey now, traveling from Nigeria to the Middle East to the UK, and you've had indelible experiences along the way. If you had a chance to do it all over again, would you do it differently?
I think if I was at the spot where I was, say, because I left Nigeria 2016. The reason why I went to Saudi Arabia was because it was an option. I didn't go there because I loved the idea. I actually had the chance to go the year before, but I turned it down. Yeah. And so I think, it was going to bring me.
So how long did you spend there?
I was there for 18 months.
Only? Wow.
Yeah, 18 months. Yeah. It was. I've had friends I've met from there that will be my friends forever. One of my close friends is we got to be friends from there. I have Arab friends who were quite helpful to me as well. I learned a bit of Arabic as well while there, so that counts for something. So I'm a lover of languages. But if I could do it again, I would probably do the same thing if I was in the same circumstance, because I really did not have much of a choice at the time. It was, like I said, they left for financial reasons, and that was supposed to be a stopgap. But yes, I'll definitely do it. Maybe I might not go back to that same part of the country with the war concerns.
Yeah.
I would definitely do it again. Yes, of course.
But considering the money, the Saudi Arabian government are pumping into money now. Assuming they ask you now to come back and be a medical doctor, one of their popular football clubs, will you go back?
I'm not quite sure. And that's not for. Of course, I'm married now. That's one thing that's changed since then. And for that reason, I can't go just because of my own personal preferences and wishes and choices. I would have to consult my wife, blah blah blah. Yeah. I'm not really sure I want to live in the Middle East. Not at this point. I might consider doing that maybe when I have kids who are in boarding school or something a few years down the line.
Yeah.
I can just go there and spend a few years. But at the moment, I think I like the Western lifestyle. I like it here. Of course, both sides have their pluses and minuses, or pros and cons. But if I had that opportunity come up, I don't think I'll take it. I don't think so.
Okay. All right. So, you mentioned that you are married, and you're looking at having kids. So, because of time, so let me ask you one final question I would like to think about. So, assuming you have children now, or let's say a son, and he wakes up one day and says, "Dad, I need to discover myself, my soul, my purpose, life," and I've decided to be a religious pilgrim. Now, not medical pilgrim anymore, a religious pilgrim, and I've decided to travel to Israel, to Middle East, to Asia. Answer. What would you tell him?
Well, there's a saying I saw somewhere,
yeah.
About I'm not putting the exact words, but was along the lines of the fact that our dads were, say, mechanics, so we can study medicine, and they will study medicine so our children can study poetry.
Yeah.
That's so. Yeah. So, but you get the general idea. And so, I don't think I'm one of those parents. I hope I'm not, because sometimes things are easier said than done.
Yeah.
I hope I'm not one of those parents who would want to police or regulate their children's career choices.
Yeah.
And so the reason why I'm here is for my children to go through things that I didn't have to go through. Things that I didn't have to. Because to be honest, part of the reason why we make all this is to study some of these courses or do some of these disciplines as specialties, because we believe that they have a higher chance of success and then decent security.
Yeah.
And so I've done that, and at this point I've paid the price of coming to this place.
Yeah.
My child tells me they want to wake up one day and become a pilgrim of any sort, not professional pilgrim, or a pilgrim that doesn't seem like in my head it might come with financial success or anything. I'll allow them to do what they want to do. I feel like once you get to an adult age, you are free to go into what ventures and adventures you want to get involved in. I wouldn't police you.
Yeah.
I'm a very, very democratic, live and let live person.
Yeah.
And I think up until when I have children who get to certain ages, I will just relax. I don't think I would police anyone. Have fun and do what you want to do.
Yeah.
And when you're tired, the whole point is the whole point of setting needs is that you have the opportunity to take risks.
Yeah.
So you can take risks, you can take 5 years off and do whatever and come back and still have a decent chance of making it when you come back to start afresh. Yeah. So that's the difference between people of higher socioeconomic classes and people at the bottom of the ladder, that you cannot, when you're down there, your opportunities are not so many, and you have to grab what you can.
Yeah.
Yes, and so, but when you're of certain means, you can afford to take off 1 year, 2 years and venture into things. So, like for example, you have colleagues who just take up 1 year and just go to, say, Australia, or go to somewhere. I know somebody went to Uganda or Kenya and stayed 1 year doing some
doctors.
Yes, doctors. Yes, they finish school, do like 2 years internship, and go to certain countries and spend like a year there or 6 months, and do a few of outreach things that they don't pay you properly.
Yeah.
And come back and continue from where they stop. And that's what privilege does for you. And so so I want to be able to give my children the opportunity to be able to do whatever it is they want to do.
Yeah. So I like the thing you say. So you are actually struggling right now so that they don't have to suffer so much.
Yeah, I mean that's the whole point. That's part of the point, not the whole point, but some of the point. I mean, and I think a lot of people would agree with me that that's what it is. I'm not really one of those I suffer so you have to suffer type person. No.
Yeah.
I think because a lot of our parents have that. I mean, so to say, a fair chunk of them have that orientation about life, which is because they're from a different generation. I wasn't born then, so I can't relate to some of the things that they do. But I feel now, if your means, your children attend good schools, you decide to not work, of course they have to work and earn a living. But you decide to take certain risks and try out things, they can afford to try out things.
Yeah.
And if they venture and come back, the door is always open for you to come back and start afresh. And of course, that's this part of the whole point.
Yeah, I agree with that, because if you think about it, like our parents, they try as much as possible to make sure we go to better schools better than the ones they went to. And in the process of going to those better schools, whether you like it or not, your orientation, your understanding, perception of life will be different compared to theirs, because you are more exposed. You are more exposed to more knowledge, different things compared to them. So the way you see life will be different to how they see life. So I'm guessing that's the same thing that will happen to our own children if we make sure they go to better schools than the ones we went to. Their own expectation, perception, everything will be different as well. But I believe I'm a laid back person, but sometimes I wonder if, and that's why I'm asking you the question. Sometimes I wonder because if you are looking at your child or your sibling who's going through something, and you know they are going through doing the wrong thing, so do we have that instinct to tell them, come on, like step away from there, this is the right path? Do you think you do that with your child? Like, if you feel like, hey, that's not the right path for your child, and maybe you think he's making a mistake, do you think you're going to step out of your laid back of nature and say, oh, come out of that way? Are you going to allow them just make the mistake?
Oh, of course not. Like I do for all my loved ones and people I care about. If I see you're taking steps that are not, I'm not going to say, okay, I want to go and become a roving man. I'm like, okay, good luck. No, we'll have conversations about it.
Yeah.
And I'll try to see your point. Of course, there'll be a bit of slide back and forth. I'm not going to stamp my feet and draw and put ultimatums for you. If you have a bit of back and forth on it for a while and see you're quite insistent, then we'll let you go. Of course, but in the process of having back and forth, I'll lay my arguments. I'll try and make you see that this is not how life is.
Yeah.
And of course, I'll make my arguments as anyone would. I think all parents would try and make arguments. What I might not do is put ultimatums and try and ban you or disown you. Things I've seen people do.
Yeah.
So the problem is I understand how that's a thing, because like I said, when you're of certain means, you might not have the luxury of certain experiments.
Yeah.
And so you might want to be more firm about your insistence on them not taking certain steps. But that's the whole point. And you notice amongst folks who have certain means, who have for better means, their kids are more likely to do this, do that, try this, try that, and get away with it.
Yeah.
Eventually, because might go and do some religious pilgrimage for 5 years and come back and decide, okay, you know what, I want to do an MBA, and they just go to decent schools and life just can't carry on.
Yeah. Interesting.
So that's the thing. So I wouldn't just say, oh, okay, all right, you want to do this, right, bye. No, we'll have conversations, just like I do.
Because that's what I ask. Because sometimes, like when you have loved ones and you see them doing the wrong path, especially people who are younger than you, and you tell them, but like you said, you don't have to stamp your feet, and you tell them they don't listen. Sometimes it's hard for us to come back when the person now makes a lot of mistakes to come back and start telling us, oh, we have that urge to tell them, I told you so.
No, yeah. I mean, you get no. I will tell you I told you so. I don't miss the chance to tell people I told you so.
Yeah.
Because when I'm telling you not to get involved in stuff, I will remind you then. I'll tell you I told you. Yeah. But I told you so is just one part. You can tell them I told you so, but still, I mean, the whole prodigal son, what's the word now? Prodigal son thing in the Bible was a thing for a reason. There's a big message there.
Yeah.
And so you tell them I told you so, but you still allow them come back into the fold
and help them out. Yeah.
And pick up their pieces. So definitely. I'm not opposed to that, I guess.
Oh, okay. Well, because of time, this is where we're gonna round off for today. Thank you so much, Dr. Ugo, for coming on the show.
No, that's fine. Thank you for having me. I wish it was a bit longer though, but it's fine. We'll do this on a different subject on another day.
Definitely. We'll do this again.